should people be able to register where they want to register?
Yes, they should be able to do that. But as the doctor said, there are lots of parameters that you might have to investigate. But in principle, yes.
My wife, from particular religion, we want to see a female doctor.
Oh, yes.
Yeah? Now, in my local surgery, she's the only one who comes once a week. When she's there, she's packed up. Yeah? Now, if I was to make a choice to go to another GP surgery and they had 2-3 doctors, I would go, but I'm assuming everybody else in Tower Hamlets will find out the same thing, and they'll all make an appointment to go and see her if that was the option. Yeah?
After I had leukemia, I had an excellent GP, the same as Carol did. When I had leukemia, he spotted it, he got me into hospital, he saved my life, and I've celebrated that fact with him. He was a fantastic GP, he saw me out of hours, and he made me do what I had to do. Then after I recovered from leukemia, we moved house, literally 1.5 miles down the road, but it didn't fall into his catchment area, so we had to change doctors. Now, I was worried about that. Rightly or wrongly, I was worried about the fact that this man knew all about my leukemia. He knew me personally inside out, yeah, and I wanted to stay with him for selfish reasons, that if it ever came back, I could phone him up and he could get me treatment straight away. That was a selfish reason. But coupled with what Carol said, he was a fantastic man, and nothing was ever too much trouble, that kind of thing. When we moved, that was the complete opposite. The doctor's surgery that we then had to have, if you like, was rude, arrogant, unhelpful. You didn't want to go there. You'd prefer not to go there and suffer.
Would you prefer to have access, i.e. lot longer hours, going to other places, or do you want continuity of care? That's the question that should be asked and hasn't been asked, and the answer that most people, in my opinion, would give would be we want continuity of care, because these experienced GPs are saying you can't actually have both. And the polyclinics and the polysystems will not supply continuity of care, and that's what the vast majority of patients need. But the other downside that we came across was that one specific surgery that I think it was a mental health need that some patient had. They lived across the boundary in Islington, came to this GP, but the services that they required, the specialist services, couldn't be transferred across the boundary.
Generally speaking, with your colds and your everyday illnesses, you want to access your doctor, obviously, as wherever you happen to be. But as soon as something goes wrong and you've got an illness that lasts a couple of months, or in a car accident and you're off work for a couple of months, then you need your local GP. So, how are you going to choose? You can't have a system where you've got to choose one or the other, because you're going to need both.
When might it be more useful for patients to access services near work? What situations can you imagine that being?
In an emergency, of course. Only in an emergency.
Or if your surgery is not open late, if it's like I just pointed out before, if the surgery finishes at 6:30 and you get home at 7 or 7:30. That's why I say all of them should stay open till 8:30.
We wouldn't want our practice, which is only one, flooded by all these damn workers in the city. So there is a need for a dedicated practice. Now, it may be unique in the city as a problem, which is for workers. Which I say, okay, I don't like the idea of polyclinics, but a polyclinic for workers and visitors in the city. Now, this happens, I think, in big urban areas like Westminster, Manchester, Birmingham. It must be the same sort of problem where you get commuters coming in and visitors.
XYZ provides free and the other costs £70. These are the patients that are coming back because their family members, one is getting free facilities, the other one's paying £70. And when they got about 4 members going on abroad, £70 times 4, it costs quite a lot, and when the other people are getting free. So it's unfair.
If we had, sorry to harp on about it, a dual system or a national system, where I had a second doctor near where I work, or that seems to be the main reason why people would want it, especially in central London, that he is my sort of like main doctor that commissions all these services, because I wouldn't get community services where I work, would I? I wouldn't need them, right? But he's my sort of second choice doctor.
Well,
actually, you say you wouldn't need them there, but you imagine a working woman that's having maternity care at work. Would she potentially want those services? For
All right, there
her,
maybe,
there
you know, I don't know that much about it. There may be
children at
circumstances.
nurseries.
But if you had the both, yeah, we all live in a home with our families, hopefully, and we're all, you know, we're all protected by GPs and NHS there. That doesn't have to change. All you're doing is saying that we're going to enhance your service by offering you a network where you can see a GP to fit your life, to suit you. Is that, you know, that's what I think we're talking about, and I can't see how difficult that is. Why is that difficult?
Your health, when it comes to the health-wise, your prescription, everything that you take should be available, like you say, on IT basis.
Again, isn't it? Because people have this thing about, I don't want my information on the card, but if we had that and you pitch up at a doctor in Glasgow or down in Cornwall, then and you're feeling sick, then they know what interactions you have. When you go to get a pill at St. Mary's, as I did last week at the pharmacy, it took an hour and I was really cross. But when I came back, she said, no, we had to get the pharmacology consultant. You're on 7 medications. And he had to cross-reference what you've just been given with everything to see if it interacts badly. Well, that took an hour. If I had the card, it would be, well, the computer would do this.
Just a little bit.
But with 2 different doctors or 3 doctors around the country, if you have that, then it makes it easier for them, or if someone visits you.
If you have a GP and you want to switch around your general practitioner, each one of them have to be accountable, and they also have to be responsible. And you also, as you said when you were speaking, the money follows the patient. How are you going to divide it? And what do you want? A floating general practitioner? So you're going to have people who are going to fall through the loop. And it's time the public access, I think the public expectation of what a general practitioner could give them is unrealistic.
There is no problem, I find, in funding, and I can suggest the funding answer, to changing your GP practice from your home to a workplace. That's no problem financially. The funding mechanism is similar to what is in the hospitals. But if a hospital takes a patient from outside its normal boundary, it can then charge or recharge the home authority. So it gets its money for the procedure.
It seems to me the flaw in the system is that there isn't enough interconnectedness. I mean, we need to have hospitals communicating to each other and to GPs, and we haven't even got that. But we need that, and I don't see what difference it's going to make. If we can get that so that everybody can communicate and understand each other, I don't see what difference it's going to make having more GPs involved.
Any choice costs money. The more choice you put into a system, the more capacity you've got to have. The more capacity you have, the greater the cost.